Hello, hello, hello. Welcome back to my channel. Thanks again so much for joining me. As promised, I am back. I promised on social media that I would come and do this video about the 2021 ICD-10 coding guideline changes. So here we go. And so these are some important updates to 2021 guidelines. And of course, you guys know every October, the ICD-10-CM, ICD-10 book comes out for the next year. So in October of this year, which is 2020, the 2021 ICD-10 book was released. And also in January of each year, the HCPCS and the CPT new version drops. So I just want to give you guys a heads up. We've been had this crazy COVID thing going on, which is very new. So of course they added some new COVID codes and COVID guidelines and things like that. And I want to share those with you guys. So I want to kind of put you ahead of the game so you can go ahead and, you got a month or a few weeks or actually about 11 days before the new year turns. And so you can kind of get ahead of it with this video and kind of know about the new COVID guidelines. And when you're coding COVID-19, it can be very tricky, especially when you factor in other respiratory issues. So make sure you listen well and take notes. And this PowerPoint is also available on Gumroad, and I'll drop the link down in the description box. And it's only $9.99, and you can purchase this and you can print it out. You can put it in your notebook. You can keep it in your email as a reference to always have. So I'll make sure I'll put that link in the description box. So let's get started. And of course, before we start, I'm going to ask you, of course, to like, comment, and subscribe if you find this video helpful for you. So let's go. ICD-10 coding guideline changes 2021 COVID-19. So here's guideline information to know. The Centers for Medicare and Medicaid, CMS, and the National Center for Health and Statistics, two departments within the U.S. federal government's Department of Health and Human Services, they provide the guidelines for coding and reporting using the International Classification of Diseases, which is the 10th revision clinical modification, which is the ICD-10-CM. The guidelines are approved by 4 organizations that make up the cooperating parties for the ICD-10-CM, the American Hospital Association, the American Health Information Management Association, CMS, and NCHS. These rules or guidelines have been developed to accompany and complement the official conventions and instructions provided within the ICD-10 book itself. Now, a joint effort between the healthcare provider and the medical coder is essential to achieve complete and accurate documentation, code assignment, and reporting of diagnosis and procedures. The term encounter is used for all settings, including hospital admissions. So the 2021 ICD-10 changes for 2021, there are 490 new codes, 47 revised codes, 58 deleted ICD-10 codes. And the updates appear, like I said, each October, but they were a little late this year due to COVID-19. So here's chapter 1 guidelines. Under this chapter, there are important updates for the COVID-19 coding. So COVID-19 coding guidelines for 2021. And also as a reference, so this is nothing I'm making up. This is nothing that I'm just saying because I know coding and I'm certified and I'm saying these are the rules. No, that's why I wanted to specifically add the reference from the coding guidelines and conventions so you can go back and refer to them for yourself. Now you will see them listed here, so I won't say each guideline every time, that I go through a specific intricate part of the chapter. So you can see here, where the section is listed, where you can go back and refer to, so you can use this as a reference to what I'm saying and what I'm, telling you guys today. So COVID-19 coding guidelines for 2021. Code only confirmed cases. So code only confirmed diagnosis of the 2019 novel coronavirus disease as documented by the provider or documentation of a positive COVID-19 test result. Now, if the provider documents suspected, possible, or inconclusive COVID-19, do not assign U07.1. And instead of saying O, I'll say 0, so you won't get confused with the letter O in coding. So again, I'll say it to you. If the provider documents suspected, possible, inclusive COVID-19, do not assign U07.1. Instead, code the signs and symptoms reported. And that's been a guideline, anyway, where as a suspected and rule out and possible and maybe and probably, we don't code those because it's not a definitive diagnosis. The doctor is not saying that this patient has this for sure. So we're not going to code what we think. We're coding what the doctor says definitively what this patient has. And if they only have signs and symptoms, with everything else being possible or suspected, then you're going to code those signs and symptoms. So sequencing of codes. When COVID-19 meets the definition of principal diagnosis, use U07.1 COVID-19. And it should be sequenced first, except when another guideline requires that the certain codes should be sequenced first, such as obstetrics, sepsis, or transplant complications. So again, I'll say it. When COVID-19 meets the definition of principal diagnosis, you're going to code, when it's the principal diagnosis, you're going to use U07.1, which is the COVID code. And it should be sequenced first, except, there's usually a lot of exceptions in code. There's exception here, exception there, exception everywhere. So there's another one here, except when another guideline requires that certain codes should be sequenced first, such as if you're coding obstetrics, that might be coded first. It might be a guideline that should be coded first and then the COVID second. Or if it's sepsis or transplant complications. So acute respiratory manifestations of COVID-19. When the reason for the encounter or the admission is respiratory manifestations of COVID, you're going to assign U07.1, which is COVID-19, as the principal or the first listed diagnosis, and assign code or the codes for the respiratory manifestations as additional diagnosis. So I'll say that again as well. When the reason for the encounter is respiratory manifestations of COVID, you're going to assign the COVID, code as the principal or the first listed diagnosis, and then assign codes for the manifestation, the respiratory manifestation. You're going to assign that as additional diagnosis. Okay, so I'll go through some examples as well, so you'll know some examples. So here we have pneumonia confirmed due to COVID, which is going to be U07.1. And then you're going to code the pneumonia code, which is J12.89. Acute bronchitis confirmed is due to COVID. You're going to code the COVID code first, and then you're going to code the bronchitis. COVID documented as associated with respiratory infection, none other specified. You're going to use the COVID code first, And then you're going to use the J98.8. So if the patient or the individual has a lower respiratory infection, COVID documented is being associated with the lower respiratory infection, you're going to code the COVID-19 code first, and then you're going to code J22. So if it's acute respiratory failure due to COVID, you're going to code U07.1, which is the COVID code, and then the respiratory failure code, which is going to be J96.0, .0, excuse me, and then whatever other digit that you may use for the definitive diagnosis of the respiratory failure. So make sure you take good note of that, because this is going to be very important. And as COVID ramps up this year, you know, we've all been seeing on CNN, Headline News, ABC, your NBC, every news outlet is covering COVID right now. Of course, as the vaccine is about to roll out. So it's going to be, if you're working in coding now, if you're in a hospital, if you're in a physician office, if you're in any healthcare setting, you're not going to be able to escape coding COVID. So make sure you know your COVID codes so it won't get denied, so they won't send it back, and it can go out right the first time. So more COVID-19 coding guidelines for 2021. So as you see here, section IC1G1D, I've listed the section. Non-respiratory manifestations of COVID-19. So when the reason for the encounter or the admission is non-respiratory manifestation or viral enteritis of COVID-19, then you're going to assign U07.1 as the principal diagnosis, and then the manifestations as the additional diagnosis. So when the reason for the encounter is non-respiratory manifestation, if it's nothing to do with respiratory, if it's non-respiratory manifestations of COVID, you're going to assign COVID, and then after that principal diagnosis, you're going to assign the manifestations after that. So let's talk about exposure and suspected and possible and ruled out. Let's talk about this because it can get tricky. Because I know a lot of coders had been emailing me where they were using the COVID code if they had been exposed to the COVID virus, you know, whether it had been negative or positive, the results. So I want to clarify some things. And as you can see, you have the sections listed so you can cross-reference me and go back and double check if you need to. But here's the information about exposure to COVID. So exposure to COVID-19. Okay, so for asymptomatic individuals, and we all know asymptomatic means you're not showing any symptoms. So for asymptomatic individuals with actual or suspected exposure to COVID-19, assign the code Z20.828, which is contact with and suspected exposure to other viral communicable diseases. So again, if it's suspected, possible, maybe, probably, you know, inclusive of, you know, we're not going to use the U07.1 code, because that code is definitively confirming that that patient has corona or COVID-19. So again, for asymptomatic individuals who had been suspectedly exposed to COVID, you're going to assign Z20.828, which is contact with and suspected exposure to other viral communicable diseases. So COVID-19 guidelines again for 2021. Okay, so we talked about asymptomatic patients. So let's talk about symptomatic people who are showing symptoms, who do have a fever, chills, loss of taste and smell, and you know, all of those things, that respiratory issues, all of those things that we see are happening. Whether you personally know someone who has had the COVID-19 virus and survived, whether you've had it yourself or, unfortunately, people who have passed away. But it's all getting so close to home where we can, I'm almost 100% certain that we all are connected in one way or another, where we either had it ourselves, we know someone who has had it, or know someone who has had it, we've had it ourselves, or, just know someone who's passed away from it. So, it's all getting close to home. So for symptomatic individuals for symptomatic individuals with actual or suspected exposure to COVID-19 and the infection has been ruled out, or test results are inclusive or unknown, assign Z20-828. And again, that's contact with and suspected exposure to other viral communicable diseases. And you can also see this guideline here, which is IC21.C. 1. If COVID-19 is confirmed, then you can see those guidelines as well. So screening for COVID-19. Now, during the COVID-19 pandemic, a screening code is generally not appropriate for encounters for COVID-19 testing, including preoperative testing. Code is exposure to COVID-19. And there's the guideline there for that. And again, remember the exposure code is going to be Z20.828. Now, signs and symptoms without definitive diagnosis of COVID-19. And there's a section there listed. If a patient with any signs and symptoms associated with COVID-19 also has an actual or suspected contact with or exposure to someone who has COVID-19, assign code Z20-828, contact with and suspected exposure to other viral communicable diseases as an additional code. Add it as an additional code. So signs and symptoms. People saying they get fevers, then you get the chills. So there's a lot of different symptoms. And I made sure I put some sticky notes on this slide here because I want you to kind of write some of this stuff down, or get the presentation from Gumroad. But this is going to be very important as we're getting slammed with COVID cases. And this is something you can take back to your practice, to your office. You can teach your colleagues about. You can tell other coders about, as the word is getting out about the new guidelines and the new changes. Because I'm sure you guys know as well, E&M has changed a lot for 2021. And I'll also do a video on that as well. So if a patient with signs and symptoms associated with COVID-19, such as fever, but a definitive diagnosis has not been established, assign the appropriate codes for each of the presenting signs and symptoms. So I'll say it simply, in a more simple term. If a patient with signs and symptoms associated with COVID, if someone comes in and got fever, if they have chills, or loss of taste or smell, or whatever, any symptom associated with COVID, but the diagnosis has not been established, the provider has not said that this patient has COVID, then you're going to assign the appropriate code for whatever signs and symptoms that this patient is having. So more COVID coding guidelines. Personal history of COVID-19. So for patients with a history of COVID-19, you're going to assign Z86.19, and that's personal history of other infectious and parasitic diseases. So asymptomatic individuals who test positive for COVID. So if you're not showing any symptoms, don't have any signs, but you test positive. So for asymptomatic individuals who test positive for COVID, you're going to see the guideline 1C1G1A. Although the individual is asymptomatic, the individual has tested positive and is considered to have COVID-19 infection. So you're going to code the U07.1. So encounter for antibody testing. So for an encounter antibody testing that is not being performed to confirm a current COVID-19 infection, nor is a follow-up test after resolution of COVID, then you're going to assign Z01.84, which is encounter for antibody response exam. Again, now if this antibody testing is not being performed to confirm that this person has COVID, or if it's not for follow-up after they've had COVID and been quarantined, then you're going to assign Z01.84 for encounter for antibody response exam. Now follow the applicable, guidelines above if the individual is being tested to confirm a current COVID-19 infection. Okay, chapter 4, diabetes. So rules to remember. Again, this is important. Write it down, screenshot, get the study guide, keep it in your notebook, keep it in your email to refer to for the new year. So diabetes and the use of insulin, oral hypoglycemic and injectable non-insulin drugs. Now, if the patient is treated with both insulin and injectable non-insulin anti-diabetic drug, assign the code Z79.4, long-term use of insulin, and Z79.899, other long-term current drug therapy. If the patient is treated with both oral and injectable non-insulin anti-diabetic drugs, assign both. Chapter 9, ICD-10 guidelines. Clarification for IC983, hypertension, CKD, and acute renal failure. For patients with both acute renal failure, which is N17.9, and chronic kidney disease, which is N18.9, if this unspecified, the acute renal failure should also be coded because sometimes it's confusing. And then let me finish. I'll go ahead and finish the sequence according to the circumstance of the admission and the encounter. And it can be confusing because I've read charts before and I would have to refer back to the guidelines, you know, when I was initially years ago started coding because I wouldn't know. You would see acute kidney injury and then you would see CKD. So you would think in your mind, okay, if I code the CKD, they're automatically saying they have kidney issues. So I don't have to code the acute kidney injury because I'm already coding that they have a kidney disease, chronic kidney disease. So here is the guideline explained and clarified for you guys. And I'll read it again. Hypertension, CKD, and acute renal failure. For patients with both acute renal failure and CKD, the acute renal failure should also, that means code them together, also be coded. And you're going to code first according to the circumstance of the admission or the encounter. Chapter 10, Coding Guidelines 2021. Respiratory failure may be listed as a secondary diagnosis if it occurs after admission or if it is present during admission, but does not meet the definition of the principal diagnosis. Read it again now. Respiratory failure may be listed as a secondary diagnosis. They're saying that you can list respiratory failure as a secondary diagnosis if the respiratory failure occurs after the patient has been admitted or if it's present during admission, but does not meet the definition to be coded as the principal diagnosis. Vaping. So look how ICD-10 codes have evolved, and that's why the books, come out every year with new codes, deleted codes, revised codes, new guidelines, added guidelines, revised guidelines. So vaping, I have books here from like coding from probably starting like 2008 or something. So I just wanted to look and see, and I couldn't find anything in those books about vaping. And of course, I have the ICD-9 books before, it went to ICD-10. I have ICD-9 books here as well. But I didn't find anything about vaping. I'm not sure if I overlooked it or it just wasn't there because vaping was not a thing 13, 15, 10, years ago. So look how, ICD-10 codes has or have evolved. So vaping-related disorders, that's what we're going to talk about here. We're going to talk about vaping-related disorders. New codes added. It's new. Just wanted to go back and look and double check to make sure it wasn't in the old books, and it wasn't. Vaping is new. So, for patients presenting with conditions related to vaping, you're going to sign the code U07.0. Now, vaping-related disorder is the principal diagnosis. Again, I'll say it again. So for patients who are coming in with conditions related to vaping, you're going to sign the U07.0, which is the vaping-related disorder, as the first diagnosis, as the principal diagnosis. And then anything else is going to be after. Now, for lung injury due to vaping, assign only code U07.0. No other manifestation codes needed. As you see here above, I was saying where I'll put my cursor here for patients presenting with conditions related to vaping, you're going to assign this code as the principal, which means you can have a secondary. So for the lung injury due to vaping, this is the only respiratory code you're going to need, the U07.0. Now assign additional codes for other manifestations. Now, such as acute respiratory failure, you're going to code that. You're going to code from the subcategory J96.0 and whatever next number it may be. And then you're going to code the next code. Associated respiratory signs and symptoms due to vaping, such as cough, shortness of breath, are not coded separately. And that's what I was saying here. When the lung injury due to vaping, you're going to code the U07.0 only. And you see here, associated respiratory signs and symptoms due to vaping, such as cough, shortness of breath, you're not going to code this separately when there's a definitive diagnosis that has been established. However, there are always exceptions. However, it would be appropriate to code separately any gastro symptoms, such as diarrhea and abdominal pain. And that's because it has nothing to do with your respiratory system. So it's like, why are you going to code coughing and shortness of breath if you already know it's from vaping? So if I'm already saying, or the provider is saying, your coughing is due to vaping, I don't need to code your coughing because I know why you're coughing. I know why you're having respiratory issues. However, if you're having other issues such as gastro issues like diarrhea and abdominal pain, then we're going to code those because it has nothing to do with respiratory. And we're not sure if it's associated or not, but you're saying you're having it at the time, so it needs to be checked out. Okay, so you ready? I'm going to give you time to take your notes. So for sepsis, and it's an infection of the genital tract, which occurs as a complication of delivery. And it's termed, excuse me, excuse me. And in this term, perpetual sepsis. Perpetual sepsis. So sepsis, we know, is an infection. We know sepsis is an infection. So perpetual sepsis, we'll go deep and talk more about that. So here is, and it says call 911 if any combination of these symptoms are occurring. So shiver, fever or cold for S, E for extreme pain or general discomfort, P for pale or discolored skin, S for sleepy, difficult to rouse, confused, I for I feel like I might die, and S for shortness of breath. If you're having any of those, any combination of those symptoms with sepsis, then it's imperative to call 911. So we already said that it's an infection of the genital tract, and any time between the onset of rupture of membrane of labor and the 42nd day following delivery or abortion, in which any two or more of the following signs and symptoms are present: fever, abnormal foul smelling vaginal discharge, lower abdomen pain, and sub-invulated uterus, which is tender. So signs and symptoms could be headache, temperature, raised temperature, vomiting. Here are other symptoms: dry tongue and lips. So abdominal examination revealed a suprapubic tenderness and rigidity. The perineum, vulva, vagina, and cervix are become infected, and lochia is foul smelling. And the treatment is the primary goal of treatment, usually concerning the causes, is predisposing factors for the infection. So they'll tell you here, as you can see, they want you to stop lactation as well until the fever, the fever disappear. They won't want you to be passing any infections or anything along to your newborn. So let's talk about COVID-19 again. These are the COVID-19 guidelines. So we're going to talk about COVID-19 again. So prepare sepsis, code O, not 0, but O as in ostrich, O as in obstetrics, O as in organ donor, not 0, but O. So you're going to code 085, code 085 should not be assigned for sepsis following an obstetrical procedure. And it's going to tell you to see this section 1C1D5B, which is sepsis due to post-procedural infection. So this code 085 should not be assigned for sepsis following an obstetrical procedure. So COVID-19 infection in pregnancy, childbirth, and peripartum. When COVID-19 is the reason for the admission in an encounter, 098.5 and the additional digit, which is other viral diseases complicating pregnancy, should be sequenced as the principal of the first diagnosis or the first listed diagnosis, followed by the U07.1, which is the COVID code. And the appropriate code for the associated manifestations should be assigned as additional diagnosis. Now remember, codes from chapter 15 always takes sequencing priority. Always takes priority. Codes from chapter 15 always takes sequencing priority. So when the reason for the encounter is COVID, 098.5 and the other digit, which is other viral diseases complicating the pregnancy, should be sequenced first as the principal diagnosis, followed by the COVID code. If the reason for the admission of encounter is unrelated to COVID, but the patient tests positive for COVID during the admission or the encounter, the appropriate code for the reason for the admission and encounter should be sequenced as the principal of the first listed diagnosis, and codes 098.5 extra digit and the COVID code, as well as the appropriate codes for associated COVID manifestations, should be assigned as additional diagnosis. I'll say it again. If the reason for the admission or the encounter is unrelated to COVID, if the reason they came in is not related to COVID, they came in for a backache, but the patient tests positive for COVID while they came to check on their backache, then the appropriate code for this reason for the admission of this encounter, it should be sequenced as the first listed diagnosis, meaning that backache or whatever they diagnose, if they diagnose that patient with osteoporosis from their backache, then their osteoporosis or their backache code is going to go first. And then 098.5, whatever other digit, and then the COVID code, as well as any appropriate codes that's associated COVID manifestations. You're going to code them additionally. So chapter 16, infection in newborn. We're digging down deep with this COVID stuff. You know, I'm going to have you guys all the way together, all the way ready. You know, when 2021 hit and all these COVID cases are coming across your EMR, whether you use Athena Health, eClinical, Practice Fusion, Epic, whatever you use, I am going to have you guys ready to tackle these COVID charts. So now we're going to talk about infection in newborn. So that's why it's going to be very, very, very important to go ahead and get that. I'm going to drop the link in the description box again. And make sure you get this presentation. Keep it in your email, print it out and take it to work, put it in your notebook. But, you know, because I know you don't have time to come back and refer to this slide and, what did she say here? Oh, something from the AFPC. Oh, I have to renew come January. But you're not going to be able to come back and look at this slide over and over again on YouTube every time you need the answer. So go ahead and just get the presentation from Gumroad, print it out, keep it in your notebook, keep it in your email, and you can pull it up. And, you know, if things get confusing at work when it comes to these respiratory things in COVID-19, and which is the principal diagnosis and which is the secondary diagnosis and what I code first and what I code last. And, you know, you just have it as a reference. So infection in newborn, we're talking about COVID-19 in newborns. You're going to be ready for the adults, the newborns, the adolescents, the geriatrics, the everybody. You're going to be ready to tackle this COVID thing. So for a newborn that tests positive for COVID, you're going to assign the COVID code and the appropriate codes for associated manifestation in neonates, newborns, in the absence of documentation indicating a specific type of transmission, meaning that you don't know how this newborn got it, whether they got it at birth while they were being born, or did they get it when they were in the incubator after they separated from mom. So again, for a newborn that tests positive for COVID, you're going to assign the COVID code and the appropriate codes for the associated manifestation in newborns. You're going to code those as well, even in the absence of documentation indicating how they got it. How they got it is not going to be important. It can be absent. That's what it's letting you know. Because you know how coding is very detailed, and you only can code what you see. You cannot make up anything. You cannot assume. You either have to query the provider or don't code it at all. So they're letting you know for this year, this guideline going forward, if the way that the newborn got COVID is not listed, then it doesn't matter. Don't worry about the transmission. It's not going to matter. So for newborns that test positive for COVID-19 and the provider documents the condition was contracted in utero or during the birth process, assign code P as in Paul 35.8. P35.8, which is other congenital viral diseases. And then you're going to code the COVID code. Now, congenital is a disease or a physical abnormality that's been present from birth. So again, for the newborns that test positive and the provider documents that the condition was contracted in utero or during the birth process, you're going to sign this P code first, and then you're going to sign the COVID code. When coding the birth episode in a newborn record, the appropriate code from category Z38, which is the live-born infants, according to place of birth or type of delivery, that should be assigned as the principal diagnosis. So chapter 21 guidelines. We're not done yet. We're almost done. We're not done yet. I hope you're enjoying this video and getting some good information and ready to tackle this coding. Everybody has a part to play. We're not necessarily on the front lines with our mask and our PPE and all those things, but coding, we're very important in this process. And as we tackle this this virus, as everything is going on, we're important. We're the ones that have to collect the data. They're depending on us to have the most accurate data. How do you think they count the confirmed cases? It's us. So we are very, very pertinent. We're important. We're imperative to this process and to tackling this disease or this condition, this virus. Observation. So the observation codes are primarily to be used as principal or first listed diagnosis only. You hear that? These observation codes are usually primarily used as first listed codes only. As observation code, an observation code might be assigned as a secondary diagnosis when the patient is being observed for a condition that's ruled out and is unrelated to the principal diagnosis. For example, patient presents for treatment following injury sustained in a motor vehicle accident and is also observed for suspected COVID infection. And I'll correct it while we're here. So if they're presenting or they're coming in for injuries from an auto accident and is also being observed for suspected COVID infection that is subsequently ruled out, So also when the principal diagnosis is required to be a code from the category Z38, which is the live-born infant, then code from Z05, which is encounter for observation and evaluation of a newborn for suspected diseases and conditions ruled out. And it's sequenced after Z38. Additional codes may be used in addition to the observation code, but only if they're unrelated to the suspected condition to be observed. Just like the motor vehicle accident has nothing to do with COVID. Those are two separate things. So that's what they're saying. Additional codes may be used in addition to the observation code, but only if they're unrelated to the suspected condition to be observed. Okay. So thank you so much for joining me. I really appreciate you guys, all of the support, all of the likes, all of the comments. I appreciate you guys subscribing to my channel. I love making these videos. I couldn't find a lot of help when, especially with YouTube videos, it wasn't a lot, as during my coding process. And a lot of veteran coders wasn't very supportive. I wouldn't call them negative Nancy's, but they wasn't very supportive. So I wanted to create a platform where we can all support each other. We can exchange information. If you know some things that, maybe I've missed or you got additional questions, just whatever it is, we're all a community that's helping each other grow and learn. We're all in this together. So thank you so much for joining. I appreciate. Don't forget to like, to comment, and subscribe. And I will see you guys later. Thank you so much.